AFIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
So good morning. I hope you're well. I'm your host this morning. I'm Dr. Aizemea Okojie, a consultant in acute medicine, and I'm out for a morning walk. I hope that you guys have had some exercise before you start to use your screens. Now, welcome to the CAN Health Hour. We want to apologize for the technical difficulties that we had this morning. There was something wrong with the Zoom, so as you know, it's not really something that we usually do, so please forgive us for that, and we thank you for your patience. We have an exciting topic for you today, and without further ado, I'm going to hand you over to Dr. Okojie, who is a consultant in obstetrics and gynecology, and who's going to talk to us about prolapses. So, Doctor, are you there?
Yes, I am.
Please take it away.
Right. Hi, everyone. I'm actually a registrar in obstetrics and gynecology. But yes, a consultant soon, by the grace of God. Hi, I'm Dr. Aizemea Okojie, but I prefer being called Aize. I'm going to be sharing my screen now, and I just want you guys to let me know if there's if you can see what I'm sharing. Can someone let me know? Yeah. Okay.
Yes, Dr.
So I'm going to be talking. Excellent. So I'm going to be talking about pelvic organ prolapse. This topic is quite dear to me, and the reason being, prolapse in itself is not something that people talk about a lot amongst the female population. And in the cohort of people amongst whom it is very prominent, it's almost like the unglamorous disease of the reproductive life of a woman. Next. So what is a prolapse, or what we call POP, pelvic organ prolapse? It occurs when organs like the bladder, the uterus, or the rectum drop and push against the vaginal walls due to weakened muscles or tissues. So it's almost like there's a hernia in the pelvic area. So I usually say to people, imagine the structures that support these structures in the pelvic region as a house. A house has a roof, it has walls and a floor. So the roof level is a structural support by the ligaments, offered by ligaments. The wall level is another set of ligaments supporting the walls of the vagina. And then the floor levels is your pelvic floor muscles. So at any stage, the roof, the walls or the floor, there can be dysfunction, and that can lead to manifestations of a prolapse. So there are different types and extents. So sometimes people are not even aware that it has happened because it's not all the structures that prolapse at the same time. So for example, you can have the bladder struggling to stay in place. So in that case, we call it a cystocele, or you can have the uterus itself dropping, or you can have the bowels at the back dropping. In that case, you call that a rectocele. And for those women who've had their wombs taken out, you can have the remnant, the vaginal vault itself can prolapse. You call that a vault prolapse, okay? So there are different degrees. So not everyone experiences the symptoms at the same time, but they can progress from one stage to the other, where initially you might just feel, I feel like there's a bulge, or if there's a lump, or my bits are hanging down. And then eventually the worst stage is when everything just comes out from the vagina, and it's very obvious. Right. So how common is this condition? So in the UK, the prevalence of pelvic organ prolapse is about 1 in 9. So 1 in 9 women will experience a pelvic organ prolapse. Of those, 1 in 3 will also have symptoms of urine incontinence, especially when they cough, they laugh, or they're trying to lift something heavy. Also, 1 in 10 women will go for surgery to manage this condition in their lifetime. So you can imagine the cost implication of this condition, as well as the quality of life and productivity impact that this condition can have. Now, amongst women in the menopause, so 50 and above, is even more prominent, 1 in 2. So out of every woman who is in the menopausal stage of her life, 1 in 2 of them will have some degree of prolapse or the other. So that's pretty common. In the UK alone, it's about 2.212 million women living with pelvic organ prolapse. What causes prolapse? So for anyone who's carried a pregnancy, the structural support of your pelvic region starts to lose a bit of its integrity because you're stretching the muscles, you're stretching the ligaments to accommodate pregnancy. So that can put tension and some sort of strain on your support. So childbirth, especially vaginal delivery, will be a very strong risk factor for it. That doesn't mean that everyone should deliver via cesarean section. No, because like I said, as long as you carry the pregnancy, you're at risk of developing it. Aging and the menopause is another risk factor because, like I said, 1 in 2 of women over 50 will have this condition. And the population in the UK, for example, of those who are going to cross into the 60s and above is almost about 60-something% in the next 10 to 20 years. And you can imagine how much more people will get into this stage and need support at this stage of their life. Obesity is another risk factor, and the rate of obesity is growing at almost 30% rate. So we really need to reel back these risk factors and control what we can control. And there are some genetic conditions that predispose you to it as well. So activities that strain your pelvic floor, like I said, heavy lifting can make you have other symptoms like the stress incontinence. But yet, when you consistently put strain on yourself and you have medical conditions or comorbidities that cause chronic coughing, constipation, that can put you at risk of a prolapse as well, because we're needing to strain most of the time in such situations. They weaken the muscle support of your organs and it can lead to prolapse. Now, how do women present? So sometimes they just come in and say, oh, I feel like there's something heavy or there's something down below, because a lot of people don't like talking about the vaginal region. So they use other euphemisms to say, oh, my bits, I feel like my bits are hanging out. I feel like there's something just there, or there's some pressure. Even when I go for a wee and after I've done my business, I still feel like there's something there. So they can that can be a bulge or a sense of something coming out of the vagina, depending on how far progressed it is or the stage at which it is caught, or they can come with urinary symptoms like leakage or cough, straining or frequent need to urinate. Again, difficulties with opening the bowels and sometimes pelvic pain. So you can see from this diagram, the pelvic floor muscles are supporting three major structures: your bowel, your bladder, your intestine. So they can put pressure, and this pressure can cause the support structures to give way. So how do you get diagnosed, or how do you make this diagnosis? Simple examination by a doctor. This is not the sort of condition that you need to do a lot of fancy investigations for, but you need to make sure you see a doctor so they can exclude other sources. For example, if there's a tumor in the tummy area, it may not even necessarily be female organ-related tumor. Anything that can cause a mass effect in the tummy area can predispose you to having it as a female. So you need to get a doctor to see you, assess you, make sure there's nothing untoward going on, and review your symptoms as well to see what can and cannot be changed or managed. Like I said, it's a simple examination, and your doctor can tell you if you've got a prolapse. Yeah. Now, in terms of treatment, there are several ways, but we always like to start from the simple before we go to the more complex interventions. Lifestyle changes for those who are obese, like I mentioned, is a risk factor. I can't stop you from aging because that's something that nature is in control of, but we can try and alter the weight by encouraging loss of weight loss and avoiding heavy lifting, or assuming more safe positions when you're lifting up objects. Physiotherapy, pelvic floor exercise training to support the strength can be useful, especially for women who've had a delivery, like vaginal delivery or after pregnancy. There are lots of exercises out there that can help you support your pelvic floor. But this is aimed at really just creating awareness, because I know that it's more common in women over 50, but you're building up your risk as you go along if you allow things start getting out of control from an early age. And indeed, young people do suffer it as well. So there are other conservative approaches like pessaries. So these are devices that are used to manage pelvic organ prolapse. There are different types and there are different structures, there are different concepts to their design. They can be challenging to fit, but they are quite effective. As a matter of fact, about 63% of women who have pelvic organ prolapse opt to be managed with pessaries. So that's about 1.4 million women in the UK alone. Now, prolapse itself, this is not the UK, globally, is a conservative estimate of about 200 million women suffering with this condition. We're not even talking about the figures from Africa, where we don't have as much data as we would need to estimate the true incidence. But I mean, these are what we can do or offer for now. And then there's surgery. Surgery is the ultimate, and there are some people that are best suited for surgery, okay? So before we go into surgery, I hope this video plays. It's just a sort of, it's a support for the pelvic floor exercises, or sort of instructions on how you can do it and make it fun as well. I hope it plays. Please let me know if it's not playing. It's all right. Playing all night. It's all. Squeeze, squeeze. Come on and squeeze like you do. I'm so in love with you. Mama's got speak. Hope that works. So this is by a friend and colleague of mine, Susan Venanza, she's a physiotherapist and she's very passionate about pelvic floor strengthening exercises. Okay, now let's talk about surgery. So there are different types of surgery and depends on how severe the prolapse is as well. For women with more severe prolapse, surgery may be recommended, and it could include vaginal hysterectomy, where you take off the womb, and also use approaches to support the top of the vagina from where you've taken off the womb. Or there are also surgeries that can preserve the womb and still try to give back structural support. There are the mesh techniques whereby you can use mesh to give extra support to the either the vault, which is a remnant of the vagina once its uterus has been taken off, or you can use it with the uterus still in place. Now, there was a lot of controversy about mesh in these sort of cases because at one point it was causing severe side effects like erosion, and was eroding through the vaginal tissue and causing problems. But the evidence is still saying that they are quite useful. And before any person is managed with the mesh, there's a multidisciplinary team discussion that takes place to see how suitable the patient is, and there are structures in place to register and to monitor outcomes. Yeah. So yes, it has its risk or downsides or adverse effects. And at one point it was banned, but they are still being used. So sometimes the repair might just be a simple vaginal wall repair to push back the prolapse of the bladder in the case of a cystocele. So you just open it up and then you push it back, push the bladder back, and then stitch it close and remove redundant tissue. And in some cases, we don't remove redundant tissue so that the vaginal length is not affected severely. And then the middle image is the one that involves repair of the posterior vaginal wall for rectocele, i.e., prolapse of the large bowel or the rectum into the vagina. And then the last image shows the technique. I didn't want to go into too graphic details, but that involves the use of mesh in supporting the uterus. The uterus is in place in this one. What do you expect after treatment? We're not just going to send you away. We're going to check up on you and make sure you're doing well. And make sure there are no side effects or adverse effects, especially if you've had a mesh repair. If you've had the pessary, you can also, you're also going to be followed up, but the currently existing pessaries require you to have clinic visits every 4 to 6 months. And that would mean that you could get delayed because of the waiting lists. In the UK currently, there's about an 18-week waiting list to get your review in gynecology. After the COVID events, gynae waiting list just skyrocketed in terms of the length. There are plans to try and mitigate this, but you know, whether you have pessary surgery, follow-up appointments are necessary to ensure that you stay healthy. Now, you are not alone. If you have any signs or symptoms that I have mentioned, or you feel unsure, speak to someone. It can affect you physically and emotionally. And a woman who has a prolapse loses her confidence, can lose her productivity, can lose her sense of well-being. So it's because she might imagine herself in this phase of life for the rest of her life, but no, there's help available. So please seek help. I'm not the sort of physician that will tell you, oh, just comfort. It's a holistic picture. So we start from the beginning and lead you and support you to you get to the end. Now, let me talk a little bit about what I do. I'm the CEO of EV3 Technologies. When old problems lead to new solutions. So when we noticed that there was pessary types, various types of pessaries out there, we noticed that the designs were not very, very, very woman-oriented, I would say, as a female myself. But there's lots of complaints of, and about 40% of women drop out of using pessaries, and about 30% of them will opt for surgery. But even then, surgery carries its own risk of recurrence, and you need to go back for more surgery, and that has its own antecedent problems. So they cause a lot of discomfort. They require frequent medical assistance for maintenance, and this can limit their long-term use. So we thought, what do we do to, bridge this gap, or to close this area of need, or to meet this area of need? So we started thinking about providing women with more comfort, accessible form of managing their prolapse, or those who opt for pessary care, and give them control of their lives. So our goal is to empower women by offering a solution that improves their quality of life and allows greater autonomy and aligns with modern healthcare needs. There are lots of talk about feminine care these days. There was a recent BBC program on prolapse and me in February. So if you go back to iPlayer, you might see it there. It is still there. So busting the myth and encouraging people to come for treatment is what, and creating awareness is what we're also trying to support. So yeah, there's some resources for you to look at in terms of pelvic floor exercises. You can go to the YouTube channel, the one I played by Suzanne Venaza. It's called Squeeze Along. There's the Pelvic Floor Society. There are lots of associations that you can get some information and support from. So yeah, thank you. And this is us at EV3, but we are just coming up, and if you need to talk some more, I'm happy to take questions. Thank you.
Wonderful, wonderful, wonderful. Thank you so much, Dr. Okojie, a tour de force of pelvic prolapse. So if anybody asks you now, everybody on this call is a professor in in prolapse issues. We can answer all the questions. Thank you so much. I mean, before I go to all the questions on the chat, can we? I wanted to ask specifically about like the psychosocial weight of it, because people who are dealing with this when it comes to incontinence and stuff like that, in your practice, how much does it weigh down on people with regards to their mental health and their ability to show up confidently in the world?
Very interesting, because I think that's one. What I always do is try to imagine myself in the place of the patient. And if I was walking around with the incontinence, leaking urine every time I laughed, every time I coughed, or every time I lifted up an object, that would completely consume my world. You see what I mean? Everything else will not matter, because I've got this little issue that's stopping me from going for functions. And I'm from Nigeria, so we like our owambe's and parties. So you can't really get comfortable knowing that you might have to run to frequently, or you need to wear support pads always. And you're thinking, when is this going to end? So you see a lot of people presenting with these symptoms, and then you find out that they've got a prolapse. You see what I mean?
Yeah.
So that will be the major preoccupation I find with them. And it's for those who don't have those symptoms and still have the mild prolapse that are quite noticeable. They may say, I'm trying to open my bowels in the morning, but I'm struggling, so I have to use my finger to push the bulge that I'm feeling backwards before I can go. And that's not something you do all the time, is it? So it can be quite debilitating. It reduces your confidence, it reduces your, like I said, your productivity, you're obsessing over it. If you imagine women in the menopause, for example, if you look at the NHS workforce, the proportion of women, I'm not too sure about the figures off the top of my head. Imagine your total workforce and a proportion of females, half of those over menopause are at risk of it. What would that do to their productivity? What would that do to their care? What would that do to their families as well? Because anyone who goes through the menopause, the whole family goes through it with that person. In terms of mood, in terms of mental well-being in terms of physical health. Yeah. So I
That's that.
think,
Sorry, carry on.
yeah. So I think though people are not very, people are reticent about talking about the vagina and everything down below, and it's not glamorous. So it's not as glamorous as saying, oh, let's just give this woman HRT. She's in the menopause now. She'll be fine and she gets her quality of life back. These are structural changes that cannot be supported by just HRT.
Mm.
So, yeah.
Yeah. I mean, you touched on some very good points there. So, sometimes like they're just words, vagina, clitoris,
Yeah.
labia, all of these things are just words. We assign the meaning to it. So sometimes we have to get over ourselves or maybe our own
Mm.
cultural norms to be able to comfortably have a conversation. Because as a doctor, if you come to me and use euphemisms, I may not know what you're talking about. And it's important that we get comfortable describing these things so that the doctor knows what the deal is. Now we have a number of questions. So question number one, if 1 in 2 women over 50
Yeah.
gets pelvic prolapse, is this the same for the Black population? Are there any specific data on that?
No, I couldn't find any specific data on it. Like I said, the incidence, even globally, is a conservative estimate of
Mm,
about 2 million people.
right.
So we don't have the figures from the motherland because a lot of people don't talk about these things.
Mm, yeah.
Yeah. I know family relatives and people growing up as I started noticing some changes in them. They were probably having symptoms of prolapse, but never spoke about it,
Yeah.
And they just suffered through in silence. And so some people consider it as normal part of aging as well.
Yeah.
So they don't talk about
Okay. Thank you. Question number 2. Should we be doing exercises like squeeze box to help prevent it? And if so, how often should we be doing them?
I would say daily if you can. Yeah, it's very useful to protect your pelvic floor. But remember, I said at the beginning, the support structures of the pelvis are not only the muscle, which is the floor level.
Mhm.
There's the roof level, there's the wall level, which are
Mm.
ligaments. These stretch like an overstretched elastic band, they lose their recoil, and so no matter how much pelvic floor exercise you do, you might not be able to control those. But pelvic floor exercises are very good. Yeah.
Very good.
I would say
Um,
once you get, please please do them, make it a habit, turn it into something that becomes a regular part of your life.
yeah.
You can do it when you're in the loo. You wanted to do a wee, you want to do it, you just kind of stop yourself halfway, hold it,
Mm,
and then you train your pelvic floor muscles that way. It
yeah.
doesn't require anything fancy.
Yeah. I mean, I think onto this point, it's like similar things we've talked about before. Sometimes because these interventions are so simple but require consistency, the human mind is that we would rather do something massive periodically
Yeah.
than something small, every day. But it's often the everyday small changes that yield the biggest results.
Absolutely. If you get
Um,
prescribed pelvic floor exercise, you refer to the physiotherapist. They tell you, okay, 8 squeezes 3 times a day, and that. How many people actually do that?
hmm,
And then they come
yeah.
back, oh, it didn't work. But did you do it? I forgot.
Yeah. I mean, even with that, there are so many things that we can do and have access to in terms of technology to help us the day that we maybe didn't have previously. So I'm very big on things that I know that I may slip my mind. I'll just put it in my calendar on my phone. So, maybe remind yourself. You put it twice a day. Have you done your pelvic exercises?
So the
Um,
physiotherapist in that video, Susan, is coming up with
yeah,
an app that there are lots of things out there, but she's coming up with an app that's, because she's got this, that's her area. She's a physiotherapist. So she's coming
yeah,
up with an app that makes it simple, easy, for people to also, um, comply with pelvic floor exercises and recommendations for strengthening your pelvic floor. Yeah.
Okay, question number 3. Do things like vaginal pearls actually help prevent prolapse?
Pardon?
Do things like vaginal pearls actually help prevent prolapse?
I'm not too sure what vaginal pearls are, but um, I don't think you can. It's like saying, can you actually stop aging? You can support your pelvic floor, but like I said, there are others part of the structural supports that may not, you cannot really do much about. Okay, so it's not something. It's like if it happens, there's support. You can't prevent what you can prevent, your lifestyle changes and all of that, lose weight and be more, train up your muscles. But if it does happen, what do you do? Does that mean you
Yeah.
failed? No, I don't want you to carry that burden. I don't want people carrying that burden. There are lots of exercises out there, lots of things out there. When I was doing my research, I was thinking, I can't even imagine doing that. I'm not even that flexible for some of the exercises you see out there. And it's like, it's just, you're being contoured into different shapes and poses. But it might work for some people, it might not work. But I'm saying, don't be too fixated on preventing what you cannot, or stopping what you cannot control.
Yeah.
Do the best that you can do. And if it does happen, there are options and there's support out there. Yeah.
So I just had a look online. Vaginal pearls, the detox pearls. I don't know that necessarily, unless I misunderstand the question. I don't think that then there's any evidence that these things
I
are
don't
going
have
to
any.
help you at all. Yeah, any effects on it? I think the
There's so
tried
many
and
things that
tested.
people are doing, injecting plasma and all sorts of things into the
Yeah,
vagina,
yeah,
but
yeah,
I'm,
yeah.
I'm
I
not going
mean,
to record evidence based.
yeah, any of that. Yeah. Okay. Another question. Does excessive sex result in prolapse?
Oh, I didn't see that as a risk factor when doing my research, but um, I don't, I don't know is the answer to
Mm.
that. Can't really make any comments to that on that, but I do know that having sexual intercourse is one of the, or reduced libido and the consequences for sexual health is something that can arise if you have prolapse.
Yeah. Okay. Okay.
Yeah.
I
So, but
mean,
I'm not too sure
from
sex
a
can
male's
cause
point
it.
of view, there's
Yeah.
lots of benefits from a man's point of view in terms of prostate health and
Okay.
stuff like that.
Yeah.
Right.
Yeah. But I don't think, no, I haven't seen anywhere where that is a risk factor for having prolapse.
Yeah.
It's a risk factor for many other things, but not for prolapse.
There was somebody mentioned that they wondered how our mothers and grandmothers manage without surgery, but I think you've addressed that there was probably a culture of silence or maybe shame. So
Yeah.
I don't think the prevalence has changed. I don't think there's any evidence of that, but potentially um, access to interventions is better, and maybe understanding and acceptance of being able to talk about it.
Yeah, so I think we need
Yeah,
to normalize that this can be a part of especially the menopausal stage of life. It can
yeah,
happen, nothing to be ashamed of. In the African setting, there are higher order parity. Some people
mm,
have 11 delivery, 12. So it's not unusual if you find them having these symptoms, but they will only come at the extreme,
yeah,
So people having that little bored, they don't talk about it. They just feel it's normal, part of
yeah,
aging. Even here, it's the same myth that people have about everything vagina. So they don't talk about it back there. And if you imagine a woman who's having the urine incontinence as a mother who's had like 7, 8 deliveries, she's worried that if I start talking about these things, what if my husband decides to go and pick another wife, a younger woman, and
yeah,
sort of things, but they're only doing themselves harm, and it's because people keep criticizing and judging what they know nothing about.
yeah,
They create a myth and fear about what they don't understand.
yeah. So, absolutely. I think this and so many other issues, get swept under the carpet and maybe don't get dealt with because we have a culture of, again, silencing shame.
Yeah.
And my opinion on things like shame is that shame causes us to run away from things that we should be running towards. So actually, we've mentioned about our families and our marriages and stuff like that. One would hope that your marriage is a place where you would have the opportunity to have open and honest conversation. Um, if anything is an issue. So, please let's work at creating those kinds of environments. If not for just ourselves, and our children are watching. It's important for us to do that as we're moving forward.
Yeah, and we're also missing out on opportunities to make an impact
Mm,
when we don't talk things. I mean, when I sat back from my practice and felt, hang on, what can we be doing to solve the problems that we have with pessaries? That came out of being exposed to it and seeing
mm,
the challenges. So if people are not talking about it, there's so many great minds out there that are being stifled by some sort of cultural, unspoken or spoken
mm,
culture, tradition, system of belief. So I think we're missing out on a lot of opportunities. How many people will benefit from pelvic floor exercises, for example? Simple pelvic floor exercises,
mm.
creating that awareness amongst them from the pregnant population onwards. Very simple things, and it will improve their quality of life.
Yeah. So another question: what happens to the rectum? Do you poo yourself?
So in terms of the repair or when
Well, I
you're
think in
having the
terms of the
problem.
context of prolapses plus, repair, I think is
Yeah, so when the rectum falls forward rather than staying, like in its natural position, when it starts herniating into the vagina, the flow of poo will actually be getting dammed. Like I said, most people have to push the wall backwards with their finger so they can expel poo. So that can lead to constipation and it build up. And when you have constipation, you can have overflow diarrhea as well.
Mm,
So, I mean, like, I totally respect the anatomy of the female pelvis. I'm not I'm not the type of person that would take anything for granted. I totally respect it because it can make or mar you and destroy your life. Just a simple thing can snowball into something else, like everything else in the body. But in particular, I'm very, very humbled when it comes to the anatomy of the female pelvis.
mm,
So yes, you can have over that would really be because of the constipation that has built up, overflow diarrhea that happens, especially in the elderly population. So
mm. There's an argument to be made that, manufacturers, as they make more things, the most recent thing is their best, and the woman was the last thing that God made. So there's an argument to be made that
this time
the
and he made the woman. Yeah.
yeah. No, so there's another question about, so what about skin tightening devices? Are there machines that are being produced to do this? And what about collagen products and stuff like that?
Like I said, the evidence, I haven't seen enough evidence for me to recommend any of these things. I'm not going to say that maybe some of them don't work,
Mm,
but I just don't have evidence to recommend them. And if you don't have that sort of evidence, I wouldn't really recommend people start doing weird and wonderful things. Like respect the vagina,
mm,
respect it. A lot of people are doing all sorts of things, like putting, what's it called? This thing they do in Nigeria where they put some sort of alkaline substance to make the vagina. You're just destroying your vaginal mucosa, really. The vaginal mucosa is like the mouth, your mouth on the inner side of your mouth. It's got cells that shed and replicate and also that produce secretions that keep the vagina moist. If you're using out those dry things, you are at risk of infections as
mm,
well because when the skin breaks, bugs are there anyway, just like bugs are in your mouth. Once there's a breach, they get in there and they cause all sorts of problems and they can ascend into your womb and to other areas as well. So I will be very cautious about those drugs, those sort of remedies. I haven't seen anyone that's evidence-based. And like I said, the vaginal skin itself is not so much the problem, it's the support structure So if you're going to do surgery for those who are not fit for conservative management, you can see that even the surgical techniques are varied. Some are simple as just opening the vaginal wall, pushing back the bladder or the back part, the rectum, and stitching that back and giving some sort of artificial support with sutures. But some you need to go and suspend with the mesh or sutures. You need to go and anchor it against the ligaments on the inside, like we call sacrospinous fixation. That's more technical. It's almost like using a hanger to hang up your coat. So you're going to take the vagina prolapse tissue and hang it up into a structure on the inside of your pelvis in the ligament. So sometimes the mesh itself, they put it, attach it, and then they hang it to the backbone, the promontory, the ligament at the promontory area. So it's very complex. It's not as simple as just putting something in your vagina to tighten everywhere up. No. I wouldn't do that. I wouldn't recommend that. You can get infections. You can injure yourself.
Yeah. So yeah, I mean, this has been very, very informative. And I think okay, so actually we've got some more questions. But let's see if our time. So what are the early signs? And again, I think some of this was in the presentation, but just because we have time, what are the early signs of pelvic prolapse before bulge?
I think most of the time, depending on what compartment, if it's the front or the back or the womb itself, it can be that frequent urination. It can be difficulty with opening your bowel. And then you come for an examination because you're feeling, oh, I'm needing to go for a wee all the time, even though I've just been. When we examine you, you see that there's some degree of prolapse going on. It's not unusual to see that. And some people are completely symptomless or they don't notice these things. See what I mean? So you can be asymptomatic, but you can be mildly symptomatic with the bulge or pressure, or there's a pressure sense of, like this is a sense of pressure down below as well. So those are the signs and symptoms that I can say. But as it progresses, you start getting a bit more the drag. There's the pelvic discomfort because things are dragging or hanging down. There's the depending on how. I mean, I've seen a patient who came in and in the A&E they thought it was I don't know, it was just like the whole uterus was just out, what we call a procedentia. So in that case, literally the whole vaginal leg just inverted itself and came out. So you literally we were staring at it just like that. And for such people, you can't really do much, especially if they're very frail and elderly. We just push it back and we just stitch up the vagina, stitch it closed. So yeah, we don't want it to get to that stage, which is why I'm trying to create awareness now.
Yeah.
Especially amongst people of BAME origin. We don't take our health seriously, and that's the truth.
Yep. That's very true. I mean, so I think we've addressed the next question, but apart from the pelvic floor exercises that you've mentioned, are there any lifestyle changes or habits that can reduce the risk of pelvic prolapse in the context of, so aging notwithstanding? Are there anything specifics that we can do to reduce lifestyle?
Yeah, like obesity is a big one. We can 30 minutes of exercise, walking, doesn't have to be intensive walking. Make sure, like I would say, when it comes to your diet, have like a sort of visual in your head where the face of a clock, 60% would be like 5 o'clock, 12 between 5 or thereabouts. No, that's 90. 60% or 60% of your plate should be your protein, your carbs, and then the rest of them you mix it up with veggies and all of that. So have that sort of approach to food will be helpful. 30 minutes of walking, 30 minutes of household chores, 30 minutes of anything that makes your heart rate go up. Okay. If you do that daily, that can help motivate you and help you to get a rhythm to weight loss as well. Weight loss is important. There are all sorts of things out there now that can help you, including drugs now that can help with weight loss and give you that control. And then for symptoms of mass or tumor in the abdomen. Sometimes these things grow because there's space there. You don't really know until you start noticing, oh, my clothes are not fitting anymore, or you're having new onset bowel symptoms, or like ulcer-like symptoms, especially in the menopausal stage of life, later stage of life. You need to go and see a doctor to make sure there's no tumor or mass or cancer going on as well. Okay, because your prolapse might just be the sign that something else is going on in the inside.
Well, what I find fascinating is all the hosting that I've done with Khan on these health hours. So much of the preventative conversation is about exercise, managing your diet. Me personally, I'm fascinated with the idea of God's original plan. If we took care of ourselves in a way that was how our body was designed, a lot of the things that we're dealing with, we wouldn't be dealing with. But yeah, we're running out of time, Dr. Okojie. Again, it's been so informative.
One last thing to say: if you drink or you smoke or you indulge in those habits, that's not going to help you in any way, shape, or form. Not only for prolapse, for everything else.
In general, absolutely. So thank you again, Dr. Okojie. It's been very, very informative for me, and I'm sure for everybody who's watching live and who is going to watch on YouTube. Do you have any last pearls of wisdom that you want to say before we let you go?
Oh, yeah. Respect your body. Respect your body. Respect your body. But we're here to help you if you have a need.
Absolutely. Thank you so much, Dr. Okojie. It's been again so much fun and really interesting to hear what you have to say. We really do appreciate your time and for stepping in at the last minute. Thank you so much. We do appreciate it. And one of the things I will say to everybody who is watching this live and who is watching on YouTube, please, you are here, you've got this information, but there's probably somebody in your circle who doesn't know what we've just talked about. So share, thank God that Khan is an organization that exists to spread this information out. So, you send people TikToks about cats and, about dances and all this kind of rubbish. Maybe send somebody these kinds of information because it will actually help them live an abundant life. So again, thank you guys. I've been your host. It's Dr. Ayo. I'm going to hand over to Natasha and we'll see you soon.
Thanks.
Thank you, Dr. Aizemea and Dr. Ayo. It was really enlightening. I even myself dropped in the comment, it's so lovely to be in Health Hour, and my health literacy is so much higher, topics that perhaps I'll never hear about because the stigma is still there. So thank you so much for bringing this forward. I know how much you wanted to bring this topic to share with us. By the questions on the chat, many people wanted as well. Feel free, people on the chat as well, if you want to put questions via email, I've dropped an email for Khan if you want some privacy, and we can try to get doctors to answer to them. Obviously, not for diagnosis, but just for some advice if you want to. Again, thank you so much for your time. I'm going to start just to share a little bit about what Khan is doing at the moment. Should be in presentation mode. Okay, wonderful. We have our Health Hour sessions every Saturday, as you know, and the next one is on the 26th of October at 11 a.m. And we'll be going through common skin conditions and black skin. Our skin conditions for us can sometimes be undiagnosed or misdiagnosed and things of sort. So I think it's important that we empower ourselves with knowledge so we can be our own advocates when we speak with our GP. So we're going to have Dr. Shidu really sharing everything that he knows on the topic that he can share with us. We also have a carol service, the Greater Manchester Caribbean and African Community Carol Service. It's on the 11th of December and will be in the Manchester Cathedral. Dr. Ayo was the host last year, and it was quite exciting. So I'm looking forward to see you all there. It's free entry. There are going to be, refreshments, candlelight readings, and beautiful choirs from our community. We have an upcoming family and advocacy session on the 13th of November. Again, this is completely free of charge to register. There is a QR code. There is an email as well for more information on the chat. And we really try to support and guide and provide some resources to individuals and families with no recourse to public funds. So if you are in this position, or if you know anyone, do recommend the family advocacy session that we have upcoming. Every first and third Saturday of the month in Gorton, we have our family hub. It's very vibrant and is a place of support, of connection, of peers. So if you are around Gorton area and not confined to that, do come along. I believe next Saturday we'll be there again. So we are collaborating with Ulster University on a menopause and diabetes study. It's about menopause and diabetes. We're really looking forward to hear from you. If you're interested in participating on this study, there is a symbolic remuneration, but the most important thing about it is that we'll be participating on research that looks to improve the health outcomes for Caribbean and African people as well. So we're really looking forward to get you participating. There is an email there, or you can also email oiza@can.org.uk, and we'll be able to guide you through it. Very important as well, if you're feeling stressed or isolated, winter can bring those energies, those feelings of unease. Cadent has a line of support. We are partnering with Cadent. The line is confidential, and as you can see, you just need to shout that number, shout out in your phone, 852558, and they are there to help. And Black History Month is not over. We still have another week of it. We've been blessed with 5 weeks of Black History Month this year. And if you're still looking for events that you want to attend to within the city of Manchester, we actually have some national events there as well. Do access via the QR code or link our calendar that we prepared this year for you with the full support of and commissioning of the Greater Manchester Combined Authority. That's it for today. Thank you so much for coming. Thank you for staying with us through the technical challenges, and I hope to see you next week.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.